No, he'll be fine.
Yeah, that's wonderful. We can do that if you're good with that.
Yeah.
You're muted, I think. No? Okay.
Okay, I'm going to go ahead and welcome us back. It is 10:38. My name is Hearing Officer Novi. As is shown in a little box at the top, we are the recording and transcription is being utilized in this meeting, and your remaining in this meeting is your consent to being either verbally or video or on video recorded. So at this point, I was told that we have a public comment. Ms. Fentis, if you can unmute yourself and just tell us the person's name.
I'm sorry, I didn't receive anything in the chat for a public comment.
Oh, okay. Okay, no problem.
He's here.
He's here.
We can see him. Is it Joseph?
Joe Pinnell.
Joe Pinnell?
Okay.
I know he
Great.
was having trouble locating the Q&A section.
Yeah, this is one of our first, I think it's our second Teams hearing, so we are still ironing out some bugs. All right. So at this time, Joseph Pinnell, if you could turn on your camera and unmute yourself and just go ahead and state your
Yes.
name for the record, and then you can make your public comment.
I am Joseph Pinnell. Can everybody see me, hear me?
Yes.
Okay, good. So I guess just to get started, so I'm actually very honored to be able to do this because I went through Paramount July of 23 through September of 23 as a very stubborn veteran with a lot of baggage, very resistant to a lot of change at that point. But I made the decision to do it myself, so I was a little bit more open. But as someone who's very analytical, which definitely helps in my career, as an analytical person, I judged every little thing that was being done. I was looking for reasons to not appreciate the process, appreciate the people that were providing me help. And unfortunately for me at that time, I was proven wrong time and time again. I was given nothing but respect. I was shown multiple tools to be able to navigate my life through the process and then thereafter. And so what I needed personally was compassion. What I needed personally was to be told the reasons why I was thinking the way that I was thinking, and be given situations or examples of other people that have gone through a similar process. And just from a very a clinical aspect, I wanted to know the whys, and I was given so much information. I was given so many different tools. I was given so much love and compassion, and they met me at my level, which again, for someone who is looking for reasons to not want to go through this process, I was caught off guard by just how much there was for me, and not just for me. You meet a lot of personalities in rehabs and detox, and they meet you at your level. And for me, it was exactly what I needed, and I didn't even know that I actually needed. And again, as a veteran, I'm used to sleeping in places that were a little bit less. Or what you would hope for is in terms of comfort. And I was blown away at the facility. But to me personally, the facility was one thing. I could go through the process anywhere. So it wasn't a priority for me to have a comfortable place to be. But from someone who does judge and analyze every aspect, the attention to detail was something that was huge for me, because they looked at every single part of the process from the intake all the way through, your final days there. They took very great care of every single part of the process. When they said they would do something, they did it. And not just that, they wanted the feedback, because I know that I went through it as they were progressing through the beginning phases or the beginning stages as a facility. But they wanted to improve. They wanted to improve each step of the way. So they would hope that you would give them feedback as to what works and what doesn't work, and how they can better provide assistance and guidance, and what is it that you need to be successful. And although I thought I knew what I needed, I didn't quite understand the um, the holistic aspect of getting well. And so for me, going through the process, it became something that I was very proud to do. I was no longer, I mean, it took a little while to get rid of the shame of going through that entire process, but it enabled me to be seen or see myself as more human than maybe I would have been prior to going there. And I certainly wouldn't have been able to do the things that I've been able to do myself. Um, I still work with the military now, although I'm no longer with the military, but I have a security clearance, and I was very concerned about that. I was very concerned about a lot of things, but I've changed my life drastically since being out. I've switched careers. I've moved states to get myself into a better location to enhance my career and enhance my life. I'm learning a language. I got my master's degree that I started 8 months after I left. I've done so many things that zero would have been possible if I stayed within the same lifestyle, if I didn't accept help, and then if I didn't, or if I was not met with the type of personalities that I personally needed to get through to the next step. So when it was brought to my attention that Paramount was going to be potentially doing an aftercare facility, I know the importance of the aftercare. I know the importance of, once you leave that building, those people, your surroundings, how important it is for you to continue to have your safe space and your ability to speak what's on your mind. And when the emotions creep back in after you're back into your old life, to be able to have the tools necessary to be successful. I I understand it as complete as I possibly could, with much more to learn. But when it was brought to my attention that Paramount would be doing that, I would have jumped at that in a heartbeat, because I am aware of the type of people that run that facility. I'm aware of the types of ways in which they wish to grow, which is in alignment with what I wish to do myself. So this is very, honestly, very exciting, and I'm very honored to be able to speak my experience. And you know, pending any questions, because I could talk forever. Um, yeah, I will leave it at that. This I think is a very it's a beautiful thing to be able to have Paramount go anywhere. It doesn't matter the location. To be able to have their mission, their vision being propelled forward to help this community that can be extremely productive members and people, and just get their life back. So I'll leave it at that. I am open to anything in terms of questions, comments, whatever. So
Great, thank you. Thank you, Mr. Pennell. Also,
absolutely
well, thank you for your service to the country.
appreciate it.
Thanks so much.
Thank you.
All right. At this time, we will go ahead and return to OHS questioning. Again, if you have anybody else who, if you would like to go in, if you'd like to sign up for a public comment, I'm going to just give you a little direction at the top of the screen. It says chat and then Q&A. You can click on that Q&A and then put your name in there if you would like to make a public comment, and Ms. Fentis will see it. It's in mine, it is third from the left. On other people's, it might be second from the left, but it should be on the top bar. And with this, we will go back to OHS questioning, and we will resume with Ms. Fiala.
Can I, actually, I'm sorry,
Oh, sure.
Alicia, this is Jen Fusco. Can I interject? Can I just sort of ask one follow-up question? I mean, we were talking before the break about existing providers in the area, sort of recently approved services, and whether Paramount had considered them. I didn't know if it would be beneficial for CC to discuss some of the letters of support we've gotten from some of those providers, just give you guys a sense of what's in there if you hadn't had a chance to look at those. You should kind
Yeah,
of list the
sure.
organizations.
Sure.
Do that before we go into that.
This is Cassandra Ruella, and highlighting the letters of support from providers. We do have a letter of support from CCAR, which is a statewide agency that works through the hospitals that refers us patients. Additionally, we worked with the Newtown Parent Connection, the Tri-State EAP, all of those letters are in there. Blue Sky, which does offer partial IOP outpatient in Danbury, has written a letter of support, as well as Liberations has written us a support in Stamford.
And are those providers that have said that they would refer to the service, even the ones that have services of their own?
Correct. And so if you read those letters, all of them have stated that given any clinically appropriate client, they will be referring to our care.
Thank you very much. Ms.
Thank
Fiala?
you. Yep. Thank you so much. So Annie Fiala, so I'm just going to actually scroll and skip to a different question that I have actually regarding other providers in the area, and referral patterns and things like that. So you have a wait list policy that you provided. And in the completeness letter, you stated, however, it is likely the client will not be able to be seen by Paramount for treatment within 14 days of the referral. The client will not be added to the wait list. How was the 14 days day time frame determined?
Cassandra Ruella, the way that in writing this policy, I determined this is that looking at an outpatient level of care, which is the lowest level of care that we're going to offer, is 14 days would be 2 sessions. And so if we cannot make it within the time frame of an outpatient client getting 2 sessions, we will refer out. It's not appropriate for us to keep them on a wait list.
Understood. Thank you. And so when you say that you're going to refer to other providers within those 14 days, speaking now to what you mentioned previously about the letters of support, do you have a list of other providers that you are going to be sending these patients to who are within that 14-day waitlist period?
Yes, we have a working list of referral partners that we work with. There's nothing formalized because we don't necessarily feel like that's appropriate, but we have a working list of referral providers in that catchment area that we would work back and forth with should that need arise, and should it arise for them as well.
And are those providers offering the same services that you will be offering?
So if you look at the table of providers that we've been referencing throughout this hearing, there are no other providers in the catchment area that offer all of the services that we provide. And there are individualized referral partners that offer some of the care that we provide. And so we would pick and choose that based on the client and what they need.
And those providers are still going to remain in the PSA. So you mentioned that you have a list of providers that's not finalized. Are those all within the PSA for the Stamford facility?
They're not all within the PSA, but there are numerous referral providers in the PSA that if someone cannot travel for whatever reason, if it's not feasible for them, we definitely have a provider that we can refer them to.
Okay. And do you have any information about their capacity or utilization for those referrals?
Unfortunately, we are not privy to their utilization capacities. And so we work with them based on their own wait list capacities and policies.
Okay. Understood. Thank you. So what happens then to if the Paramount's policy is to not add them to the wait list because of the 14 days, but they're unable to be referred to another provider or to another provider's wait list, what happens to that patient then?
That's not an experience that we plan to have because our admissions department will not let go of that patient unless they are placed with another provider. If they refuse, then that's obviously their free will. But as far as where we stand, we will keep a touch point on them until we can warmly place them with another program.
And then also you provided a referral policy for patients with needs that Paramount cannot meet. And so that policy does list potential referral recipients. Do you have agreements with these providers already in place?
Again, it's not formalized. It's a working relationship that we manage on a day-to-day basis.
And how are these providers identified to be put on this list then?
They're providers that we've worked with in the past that have proven their clinical standards to be up to par with what we will refer to. So personally, I've traveled and I've toured most of these places. My team has toured. We've met their administration, we've met their clinical teams, and we trust them to provide the same level of care that we would provide.
And then just wanting to continue on with the questioning regarding relationships with other providers. Have you entered into any reciprocal relationships with behavioral health providers in the Fairfield County?
Again, nothing is formalized. We have working relationships definitely with providers in the Fairfield County, but along the same lines as everyone else, we're not writing down these relationships. But because of those letters of support, it remains clear that providers in the Fairfield County are working well with us and welcoming us into that catchment area.
Okay, thank you. So I'm going to turn now to statements in the application made regarding readmissions. Do you have any data confirming the statement that, quote, many readmissions occur because patients lose continuity of care due to geographic barriers and cannot sustain meaningful follow-up after returning to Fairfield County or New York?
So clinically, the knowledge about continuity of care for Fairfield County and New York is based on geographically where those clients are coming from, because the data points are, if you don't have a continuous step-down model, if you don't have transitional care strategies, and if you're not doing it in the scope of social determinants of health, which is that geographical location, that's where that data comes from. And those sources are psychotherapy and the therapeutic relationship in 2024, the impact of continuity of care model from hospitalization to outpatient clinic with severe mental illness from 2023, the National Action Alliance of Suicide Prevention in 2019, and most of these things I believe have been submitted.
Yes, those are linked at page 25, Annie, of the hearing submission.
Great, thank you. So you also state that readmission data shows the need for outpatient care for residents of the proposed PSA. What is the number of patient readmissions that come from the proposed PSA?
We've looked at like Stanford Hospital's readmission rates. Can we look at those? Hold on. Or did we just do
Yeah,
state?
we may have just had a statewide readmit rate, but that's certainly something we can put together for you in a late file. I think we had looked, or you may have looked at the overall readmission rate in Haddam.
Oh, I definitely looked at the Haddam one, but I thought I looked at the catchment area too. Give me 1 second. I'm sorry, give me 1 second.
Sure, take your time.
So what I'm looking at is identifying that as of 2025, Connecticut's average hospital readmission rate is 15%. The behavioral health multiplier in the Fairfield County is roughly 20%.
Okay, thank you.
I'm going to ask for a late file on that.
Sure.
Okay.
Let's do a late file. I'm going to give you a chance to expand upon your answer on that. Let's do a late file. This will be, do we normally do numbers or letters? I am blanking.
Numbers, I think.
Numbers. We'll do late file 1. The readmission data for outpatient care in the proposed CSA for or sorry, not CSA. I just said Community Shares of Agriculture, PSA. I apologize. We are not buying vegetables. PSA.
Thank God.
Any other follow-up questions, Alicia, or are we good to
No.
continue?
No, we'll just go ahead. Sorry.
Sounds good. Thank you. Okay, so Paramount Wellness Retreat in Haddam is approved Medicaid provider, and Paramount will apply to become one for the Stanford facility. Correct?
Correct.
Okay. So what's the timeline for Paramount Stanford's application process for the 1115 waiver?
So, Cassandra Ruella, in order to apply for Medicaid, we're obviously still determining based on when the CON gets approved, when licensure gets approved. So it's not a black and white science. What I would be looking for is that within the first year of operations, we would apply for Medicaid, being an in-network provider. Additionally to that, looking at the 1115 waiver, I had spent ample amount of time between 21 and 22 in a nonprofit Medicaid provider running 1115 programming. So everything that is being built in Stanford will be 1115 compliant from inception. And then in applying for Medicaid, I believe that my plan, again, it's an art, not a science. So, but my plan would be to apply for both at the same time.
Thank you. So initially, I believe it was stated that on the onset of opening up Paramount Stanford, that there will not be any shift in volume for the Medicaid and Medicare patients, or for the other providers in the area who serve Medicaid and Medicare, correct?
Sure. Correct.
Yeah. Okay. So once credentialed, though, will that affect the referral patterns for the other providers in the area?
Cassandra Ruella, and because of the underreported and untreated population of clients who are on Medicaid, I don't believe that it will do anything more than a negligible shift.
So are you expecting all of the Medicaid, Medicare increases to be from the population not currently being served?
I would expect that the majority of that, because we will also be promoting ourselves and bringing ourselves into the community and identifying ourselves as treatment providers. So we would hope that underserved populations would reach out to get served. Additionally to that, it's the people who are not getting care from those referrals that we've talked about previously in this hearing, in order to not shift it in a huge way. But we know that there's a huge undertreated population of people who are on Medicaid. We also have a business development team that will be entering the community, like I just mentioned, but that's that team that will go into that community and will market it in a way that we're not attempting to take clients from other people. We're looking to treat the people who are not being treated.
Sure they know about your services, right?
Yeah, and yeah, providing the information so that also community resources can provide our information and allow people to remain informed about the care that we provide.
Okay. I believe I already know the question to this, but I'm going to just ask anyway.
By all means.
Has Paramount established an emergency transfer agreement with Stanford Hospital or any other providers that clients may be transferred to?
We are in talks with Stanford Hospital currently. And as far as Haddam goes, we do have an established transfer agreement with Middlesex Hospital.
Okay. Are there any referral agreements or documents attesting to the relationships with these other providers?
The letters of support.
So you estimated that about 25% of your Haddam patients would go back to Stanford for their step-down care.
Correct.
Do you anticipate that being your total patient volume, or would you be seeking and accepting referrals from other residential treatment facilities?
Yeah, that would only be a fraction of our total population that's being treated. We would definitely accept referrals from other modes.
Great, thank you.
Right.
In the completeness letter response on page 4 to question 2B, you state that Paramount has a case management assessment that they use for non-clinical wraparound services as part of the referral process. Could you walk us through that process, please?
Hold on, let me just pull it up.
I'm sorry, can you say again which page that was on in the completeness?
Page 4 is the response to question 2B.
Oh, are you asking for me to walk you through the assessment?
Yes, please.
Oh, okay. Sorry, I misunderstood the question. So yes, we have a case management department, and in line with a clinical department who does a biopsychosocial assessment within a certain amount of time after intake, the case management department provides a case management needs assessment, which includes housing, legal, employment, social determinants. That's how we kind of assess for all of those things. The result of that assessment will allow for us to continue that care of like aftercare. Sometimes that will include referrals for housing, for employment, for logistic things that are not necessarily clinical. And so we start that at intake by doing that assessment.
Are you able to provide us a copy of that assessment documentation or document?
That assessment was attachment completeness 2B. It was submitted with the completeness responses.
Perfect. Thank you so much.
Yeah, absolutely.
And then my last question is, during the pendency of this application, Paramount changed the location from 30 Mayano Lane
Yeah.
to 1290 Summer Street, both within the same general area of Stamford. Can you just update us on the status of this location?
The lease has been executed for 1290 Summer.
Great,
That
thank you.
should
And
not be changing again.
perfect. And how long is the lease for?
5 years.
Great, thank you. Those are all my questions.
Thank you.
Okay, at this point, I'm going to ask we take a quick 5-minute break after or at the end of Ms. Fiala's questions. We'll come back at we'll give each until 11:12, and then we will go ahead with any questions from Mr. Lazarus, and then additional public comment. And if you would like to sign up for public comment, it's you just put your name into the open Q&A. Thank you.
Thanks.